Health experts are now warning the next pandemic could already be here, infecting bird populations in every province. Sorry about the bad news. The H5N1 strain of bird flu infects millions of birds a year, both in the wild and on farms. Now, H5N1 doesn't infect humans, but health experts are warning that if it does become a pandemic, it might be worse than COVID. Joining us this morning to explain is Associate Dean of the Ontario Veterinary College, Dr. Shayan Sharif. Welcome to your morning.
Thank you very much for having me.
How has the virus affected Canada so far?
The virus, as you indicated, has already infected birds across Canada. All provinces in Canada have reported cases of this particular strain of bird flu.
And we recently saw a mammal-to-mammal transition of H5N1 at a Spanish mink farm. How concerning is the fact that this virus has the ability to move so quickly?
Unfortunately, it is very disconcerting because this virus seems to have become more and more adapted to mammals. And when a virus becomes adapted to mammals, then it means that it's probably just a few mutations away from gaining the capacity for transmission. We can't really say this with a significant amount of confidence at this moment, but I guess there are various different pieces of the puzzle that seem to be coming together for this virus to become transmissible among mammals.
Right now, animal to animal, but how likely is it that it will jump to humans?
Optimistically, I would say at the moment, the likelihood of that is low. The virus has indeed jumped from animals to humans in the last year and a half or so. But those individuals have become, I would call them terminal hosts, meaning that they have not been able to transmit the virus to other humans. So if the virus remains as such, then there is significantly low likelihood of this virus being able to transmit from humans to humans. But there's always a chance.
The World Health Organization says that H5N1 could have a fatality rate of more than 50%. So how similar is this particular virus to, let's say, something we're more familiar with, like SARS or COVID-19?
So a case fatality rate of this virus could be much higher than COVID-19. Another virus of the same subtype, H5N1, a few years ago created significant amount of worries among researchers and health authorities because that virus had a very high case fatality rate of approximately 30 to 50%. But it was quite limited in terms of number of individuals that it infected. It only infected, at least based on the evidence that we have at our disposal, approximately 900 individuals were infected. And of those 900 individuals, approximately 450 of them unfortunately succumbed to the disease. But it was a different virus. Although it was H5N1, it behaved quite differently from the virus that we are looking at today.
So how can we then best control the spread so we don't see another devastating pandemic?
There are a multitude of different strategies that we can utilize. Number one, look at some of the environmental factors that lead to the emergence of these new viruses, such as, for example, the impact of climate change. I think long-term strategy should involve looking very carefully at climate change as one of the contributing factors to the emergence of new viruses that can jump from animals to humans. That's just one of the contributing factors.
And how does climate change play into that? Sorry, doctor?
Climate change has created significant amount of changes in behaviors of animals, and such as, for example, migratory birds. And as you correctly pointed out, it has been going around among migratory birds. So any changes in their behaviors in terms of how they migrate, in terms of the length of time that they stay somewhere for breeding, for example, those could actually have some impact on emergence of these viruses. So that's one component. The other component of our strategy should involve significant amount of emphasis on surveillance of animals, humans, and the environment, because these viruses are usually in the environment, and we have to have a better understanding of how they spread in the environment. And on top of that, I would say that vaccination should be one of the tools in our toolbox. At the moment, it is not, neither for poultry nor for humans. And I think that's really something that we have to look at very carefully for the future and add it to our toolbox.
Dr. Shayan Sharif, good to have you here. Thank you.
Thank you so much for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.